Beth Salcedo. I'm the medical director at the Ross Center. We are a multidisciplinary behavioral health practice. We offer treatment for both children and adults, and we have both psychiatrists and psychotherapists offering that treatment. I'm joined today by Dr. Kristen Everett, a child and adolescent psychiatrist, who is here to talk to us about what makes a psychiatrist unique and what the role a psychiatrist can play in a patient's life.
Hi there, my name is Kristen Everett. I am a child psychiatrist, also board certified pediatrician.
Dr. Everett, can you tell us a little bit about what a child psychiatrist is?
Absolutely. So I describe a child psychiatrist as a medical doctor. That means they've completed the general basic medical training, but they have a specific expertise and focus in all problems related to behavioral, developmental, mental, and emotional health and well-being. So this includes the way we feel and think, how that impacts our behavior, but also the understanding of the biology behind it, environmental factors that take place. And they're able to come up with an appropriate treatment plan that is age appropriate for the developmental stage of the child. So child psychiatrists specifically have an in-depth understanding of child development, and so understanding what is typical development and being able to identify when there are deviations from that and how to intervene early with the proper treatment to improve the quality of the child's life as they continue to develop. Common conditions a child psychiatrist would evaluate and treat include anxiety disorders, children who are handling big feelings or maybe having trouble controlling emotions, behavior problems at home and at school, maybe problems with learning or making and keeping friends. We also see teenagers who have trouble with substance use, kids who've maybe experienced significant trauma in their lives. So a myriad of different conditions that might affect how a child feels and subsequently behaves. I'd also add that an important role of the psychiatrist is to act as sort of a liaison between the other teams involved in a child's life. For example, their school team and learning team, their primary care doctor and pediatrician, and as well as any extended family members that might play a major role in the day-to-day care of a child. So again, helping to collaborate between all those forces to make sure that we're on the same page regarding a treatment plan for the child.
Great, thank you. And a child psychiatrist has very specialized training. Can you describe a little bit about that training as compared to an adult psychiatrist or pediatrician or even a nurse practitioner?
Yeah, absolutely. So the training for a child psychiatrist, oh boy, do I remember the years of that training. So again, medical school. That is about 4 years or so, based on most programs, and all medical doctors undergo that training. So that's where you're learning the biology and the biochemistry, pathophysiology of how disease develops in the body and understanding how treatment works. So your surgeon, your pediatrician, your psychiatrist all have to go through that process. Then a child psychiatrist goes through a specialized training with a focused area in psychiatry. So that's similar with your adult psychiatrist. They are learning the fundamentals of identification, diagnosis, treatment of various mental health conditions. And that is about 3 to 4 years, followed by even more training, specialized though, in child psychiatry, which is understanding child development, but then also the evidence-based practices that are appropriate for a child's age, what medications are maybe appropriate, what type of therapeutic strategies. And so again, it's that very specific, extensive focus. I would say pediatricians, they also, as a part of their training, do learn how to identify and treat mental health conditions. Again, when you think about their knowledge base, is much more broad, right? They are treating and identifying conditions throughout the body. So that includes the heart, the skin, your lungs, but yes, also the brain and mental health conditions. So they are equipped to identify and treat likely mild to moderate cases, but I would say, given the depth of the training, that more complicated cases would likely be referred to for a specialized evaluation. So the pediatrician is a great line of defense to identify and determine which children need that more specialized evaluation. Adult psychiatrists, similar to a child psychiatrist, have that understanding of seeing pathology and mental health concerns throughout the lifespan, but is more focused on its presentation in adulthood. And so the child psychiatrist, again, has that more extensive training and how that presents in childhood from infancy through adolescence. Your nurse practitioners, as stated in the name, they are nurses, and so their clinical background, training, and education is in that patient care delivery at the side of the bed, and they have that level of training. They then to practice as a nurse practitioner do go through more specialized training, but again, when you think about the level of years, that is a difference, knowledge base and framework. So again, they're able to prescribe medication, diagnose and treat, but for some of those more complicated cases would warrant then seeking a more specialized provider.
Okay, great, thank you. So let's say I'm a parent and I know that my child needs some treatment, but I really want them to start with therapy and not medication. What would be the benefit to having them see a child psychiatrist?
Yeah, this is such a great question. I certainly understand the concern and hesitancy with medication. But I do want to say not all patients who see a child psychiatrist are even recommended to take medication. So I would say there are a lot of benefits of seeing a child psychiatrist, even if you're awaiting a therapist, to really get that comprehensive evaluation. And so that's going to look like an extensive history and information gathering. What's the family history? What are the biological factors that could be impacting what challenges you're seeing with your child? In addition to that, they're also able to give recommendations or resources for the school system that might be impacting what's going on. We're thinking about any medical concerns that might also be impacting their mental health challenges. So again, being able to get that broad evaluation will help to identify goals, to explain and provide some awareness of what's going on with your child, but also to talk about the types of therapies that might be helpful. So I think oftentimes parents know you're looking for therapy for your child, but what type of therapy? And so seeing a psychiatrist can help to identify what those therapy treatment goals are. There are different types of therapies for different types of conditions. There are also parent-only parenting therapies that we might recommend. And so again, seeing your psychiatrist can help you to have that framework of what would be best suited for your child. In terms of medication, when they are warranted, the goal of the psychiatrist is really to make sure the parent is armed with all of the information to make an informed decision. So we want you to know of the evidence-based treatment options and why we'd be recommending them, the risk and benefit. So you would have all of that information, whether you're making the decision to start or not. I think also just working with an expert in child development and understanding how these medications affect the body is just someone that you now have a relationship with should things change or evolve, or you want to make decisions down the road about starting or trying a medication. So really for all of those reasons, I think seeing a psychiatrist for that initial evaluation and support while you're waiting, getting plugged into therapy, could be very beneficial.
Thank you. Do child psychiatrists do therapy? And if they do, what is different about the therapy that they provide versus that of a counselor or a child psychologist?
So I would say yes, and it depends. So all psychiatrists, as a part of their training, does involve learning the basics of providing therapy. And what does that mean and look like? That is creating the setting and environment that your patient feels safe to be able to talk about some very challenging things. And then that can be problem solving skills or providing in the moment support to help with some of these acute issues. But it depends on that provider's level of training. And it depends on their interest in certain therapies and perhaps the practice that they work at too. So there are child psychiatrists with a specific interest in trauma-informed work. So they may have that level of expertise and provide therapy for that, or cognitive behavioral therapy. I would say most of your child psychiatrists are doing some level of therapy work in their visit with the child. And a lot of that does look like supportive therapy, talking through concerns and problem solving together. All of that is a form of therapy. To determine what type of therapy your child psychiatrist might provide, you would want to ask them. And certainly if they don't provide that specific type of therapy that they're recommending, they know where to send you and who to refer you to get that level of treatment.
Right, thank you. So can you tell us a little bit about what the first visit with a child psychiatrist involves, what it looks like, so to speak?
So the first visit with a child psychiatrist, the main goal of that is getting to know the family, getting to know the child. And so that is a lot of information gathering. Sometimes this can be divided over a couple sessions, but really the child psychiatrist wants to introduce themselves and give an overview of what that visit might look like. The first visits are generally longer, but again, the goal is we are trying to collect all the information that we can to make an informed kind of conceptualization or a framework of what's going on and how to best help your child and family. Oftentimes the child psychiatrist will meet the parents separately to get a good thorough history of their medical history, including pregnancy and delivery and any learning challenges, how they met their milestones throughout growth and development. We also want a full detailed history on family history, understanding any mental health concerns in the parents, right? That's going to help inform our understanding and care of the child. We meet separately with the child generally to talk to them about their interests, right? What is going to help them be comfortable in the setting to talk about some very hard things. For teenagers, oftentimes we want to meet with them separately because in this age we are trying to reinforce autonomy and taking some ownership in their care and what's going on with their bodies. And generally our goal would then be to bring the family and teen together to have alignment of goals and discussion together. Most of the time, we're able to provide some information on what diagnosis we think is going on in the course of treatment in that visit. Oftentimes, we might have a separate visit to allow us time to collect information from those other important players in your child's life. So that might be talking with your child's teacher or talking with your child's therapist to gather all the data we can to make the most informed diagnosis and treatment plan.